Thanks again for joining us for the 2020 Share the Spirit event. We have 9 equipment requests that total over $35,000. As usual, the departments requesting items were very creative, so you'll have some tough decisions to make. Once you view the requests, don't forget to vote.
Hi, I'm Heather. I'm going to be your nurse today.
Hello there. My name is Hal.
Hal, how are you feeling today?
My chest hurts.
Oh.
It's like there's an elephant standing on my chest. I feel dizzy.
Well,
I feel really nauseous.
You've got a lot going on. We're going to get you hooked
I
up
feel
and
weak.
see what's going on.
My heart is pounding.
Yeah, we'll put you on the monitor
My chest.
to see what's going on with your heart.
I can't catch my breath.
Heather, how's Hal doing?
So I'm getting him hooked up, but we don't have a monitor.
We don't have a monitor. We can't monitor his heart rate, his oxygen level. We can't even see what his blood pressure is.
No.
Hi, my name is Mary Burns, and I'm the clinical educator here at St. Clair in Baraboo. And I want to introduce you to our simulator, Hal. He's a very vital part of education here. Hal is used by our nursing staff, our residents, our CNAs. He was a generous donation about 9 years ago. So as you can see, Hal's breathing normally here, but I can make Hal's breath go very, very slow and make his lips turn blue. I can make his breathing go very, very fast. I can change his lung sounds to wheezing or rhonchi, diminished. We can monitor his heart rate, and I can change the rhythms of his heart. We can do CPR on him. We can shock him. Residents can listen to his heart and listen for murmurs. Hal can be intubated and actually put on a ventilator and monitored. Hal has pulses, so this is a great feature for new CNAs. They can practice taking pulses. So he has a radial pulse, he has a carotid pulse, and he has a pedal pulse. Nursing staff can also practice doing injections on Hal. And the ER folks love this, that they can practice doing an interosseous catheter with Hal. And they can tell if they have proper placement in the bone. So Hal is a great asset to us here, but unfortunately we're not able to use him to his full capacity because we don't have a monitor. So we can't see what is going on with Hal. So we haven't been using him much. And we have mock codes. This would be excellent. It would be excellent to train our new ER nurses. So my request is to get a monitor for Hal.
Thank you for your time and your consideration.
All right, my name's Mallory. I'll be your physical therapist today.
Awesome.
We're gonna try to loosen up that knee to
Sounds
start.
good.
We'll hop on our exercise bike here.
Okay.
Now she's a little old, so she makes some noise.
Okay.
When you sit down, she might clunk a little bit.
Okay.
So just heads up.
Oh, wow.
It does try to clunk.
You weren't pretending on the clunking there.
And then I know you're pretty stiff,
Yeah, thank you.
so we're gonna start with some little U's
Okay.
just to start. And it's gonna beep at you a little bit as we go.
Okay.
It doesn't stay on.
Yeah, it looks like it just turns back off then.
Yeah,
Okay.
so once we can get all the way around, maybe it'll stay, but for now we just gotta listen to the beep.
Okay.
If you think you can't go forward, but you might try backwards, you can certainly take your time and work your way around, but it goes really fast backwards.
Okay.
I can't put any resistance on. But we'll see how you
Oh,
do.
wow.
Ooh,
Yeah,
yeah. That's a big jump all of a
It
sudden.
is a big jump.
Yeah. So, there you go. Oh, there it goes
Yeah,
quick.
yeah.
Okay. So, as you can see, this bike isn't ideal for what we use it for in physical therapy now. It's beeping away. The physical therapy department would like to purchase a new bike with the abilities of resistance, pedaling backwards, the seat won't clunk, and the screen can stay on the whole time the patient's on the bike, so we can keep our timer going, we can keep the resistance on. Yeah, we just think it'd be a good update. This one's from 2009. I think it's time to get a new one. So that would be great.
Thank you very much.
Thank you.
Hi, my name's Alicia. I'm one of the occupational therapists here at the Meadows, and lately I've been cranky. Not because I'm 7 months pregnant, but because our table stopped working. Normally we can use a controller that we can raise and lower the table, so if we have a patient down here, they're able to stand with the table higher, or we can lower it if they're sitting in their wheelchair. So now I have to manually raise and lower it with this crank. So I have to put this in here, and typically my belly gets in the way, and it takes a lot of energy to move it up and down, which is energy I don't have right now. While Cindy over there can easily raise and lower it by using the button. So we would really appreciate it if we can get a new table so our patients can be able to stand and do activities easier, and so we can get rid of the crank. And I'm not talking about me this time, this crank.
Hi, welcome to the St. Clair Sterile Processing Department's decontamination area. I'm Joyce, this is Courtney. We are asking for your help in purchasing a pure processing eye washing station with pump. We're requesting this because the eye instruments are such a fine instrument compared to our general instruments that it keeps the instruments contained in a smaller basin. It has an eye or a drain catch system, so we aren't washing our instruments down the drain or dumping our instruments down the drain with the dishwater. We are currently rinsing each cannulated instrument with four syringes of wash solution. So the pumping system would eliminate this process, so we don't have to worry about Courtney getting arthritis before she's 30. We do around 15 sets a day, and this will help with the efficiency of getting these sets turned around. That's our smallest cannulated instrument.
Oops, $200.
Down the drain.
But yeah.
So when you think about your eye instruments for your family, yourself, you'll want them done right.
Hello, I'm Kim Kelly, a physical therapist at St. Clair Meadows, and today what we're requesting is a replacement for our NuStep, which is one of our most popular pieces of equipment that patients use here. Residents that are here for rehab, as well as long-term residents, come down and use it after they're done with therapy to help them continue to be mobile. Several issues we're having with this model. One of them is that the seat is not very ergonomically correct. It's difficult for people to reach back for the handles. They're so far back, as well as the seat is sloped forward and wearing out a bit, so it's easy to slide out of it. We've had some safety issues with some of our weaker patients or more petite patients getting them on and off of this model safely, as well as the fact that the handlebars are more difficult to raise and lower, which makes it harder to get them on and off or for people to adjust it themselves, as well as the fact that we can no longer get replacement parts for these, which do wear out because of the fact that we use them so frequently. And then I will show you the newer model, which we are hoping to replace it with, which has a more ergonomically designed seat. I'm just gonna swing it around here. In which case the handles are further forward, so I can reach back for it and I can sit more safely. The seat is no longer sloped forward, so it's easier for patients to get on and off of it, as well as the handlebars adjust really smoothly for residents that do get on and off of this themselves. And the adjustment for the seat is very smooth for them to be able to turn it themselves if they are able to, or for us to be able to get them on and off with greater ease.
Hi, St. Clair Foundation.
This year, the day surgery department is asking for a fluid warmer. We all have friends, family, parents, kids that are going to surgery, and as we all know, surgery is freezing. So if we could set them up with a nice warm bag of fluid before they go back, that would be amazing. So to show you what we are talking about, we have put together a little scenario.
Here we go, yo. Here we go, yo. This is what's our scenario. It doesn't matter if you're young or old, when you're going to the OR, you're gonna get cold. Yeah, cold. We all love to be warm and snug, but if you're in the OR, you only have air in your mug. A warm blanket is a toasty treat. However, in the OR, you're gonna have cold feet. Yeah, cold. How great would it feel to have warm fluids in your veins, keeping your whole body warm through the aches and pains? The nurses and the doctors can warm your heart. Fluid warmer will keep you warm from the start. To feel warm from your head to your toes, even in the OR, the warm fluid flows. Thank you for listening to our cool beat. Pick us a warmer, that would be a real sweet treat. Michelle, Kitty, Big Jack too, don't forget, all about Lou. We're out.
First, let us introduce ourselves. I'm Beth.
And I'm Shane.
And we're here to pump you up. Really, we're here to talk about what we need for our audiology department. Shane and I are asking for an updated visual reinforcement audiometry system. We're going to go into my booth and Shane's going to operate it. So come on in. This system we use for our patients, pediatric patients, infants, toddlers, and we also use it for special needs adults, those adults who may not be able to respond by raising their hand or pushing a button, but they're able to turn and look towards sounds. So the system that we're asking for is a speaker system that has visual reinforcement animals, lights that flash on it. When we're testing children, and parents know this, we have kids who don't have a very long attention span, so we need something to kind of make this evaluation a lot more fun for them, keep their attention, and make it so that way when they come back for retesting that it's something a little different by presenting different sounds, different lights, toys for them to entertain them. We see a lot of patients, a lot of pediatric patients in our booth, and we would love to have an updated system to make their experience be better in our office.
And you're doing a great job. We got 20 minutes in so far, but you still got 10 minutes to go.
I do.
So keep up the good work.
I keep up the good work.
Okay, thank you.
Yes.
Well, we gotta wait for the treadmill today. Do you need a chair at all? Lunch. You need lunch? Well, I'm sorry, we won't be serving lunch. We just got tonight. Yeah. But thank you.
Well, if you're offering chairs, I'll take one.
Karen, I will get you a chair.
It's going to be a while, it looks like.
It is going to be a longer wait today. Sorry about that. And Jeff, as you can see, we got a long line today. Do you need a chair at all? No. Okay. Thank you for waiting. You betcha. As you can see in cardiac and pulmonary rehab in the Dells, we have a need for more treadmills. We would appreciate if the spirit of giving and its members would be willing to assist us with donations. Thank you.
Hi, I'm Wendy Job from St. Clair Meadows Care Center. We're asking the Spirit of Giving Circle to support us in purchasing one stationary camera for our chapel and one mobile camera for the activity lounge so that we can provide closed circuit broadcasting directly to resident rooms. These cameras will allow us to provide live chapel services and also events such as games and entertainment directly to resident rooms during COVID restrictions and far beyond. Here to explain it better is King George. Queen Sam from Activities.
You say, what happened to all of the fun? COVID took it away. You cry. What about bingo and sing-alongs while we're trying? Why so sad? Remember we made an arrangement to do group events. COVID's making me mad. But remember, despite our restrictions, we've got plans. We'll be back in their rooms. We'll use 2 cameras and a bit of Zoom. We'll be back with church and more. We'll remember what it's like to explore from their rooms, from their beds. We can entertain them all instead. And when push comes to shove, I will even juggle these bananas to remind them to have fun. Da 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 da. You miss Bunko and you can't go. With cameras we can stream it to your room so you'll have fun. And no, don't change the subject. These cameras are the subject. My sweet spirit of giving subjects. My loyal meadow subjects. Forever and ever, you'll make their lives better forever. We'll be back, thanks to you. We'll have 2 cameras and we'll say, woohoo! We will smile, we will play. We'll say thank you till our dying days. So vote for us, or we'll go mad. Please don't throw away this dream we have, 'cause when push comes to shove, we need these cameras to help fix this and remind them of our love. Da 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 da. Everybody, da 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 da.
Okay, now it's your turn. Don't forget to vote for the items that you would like to see funded. Go to surveymonkey.com/r/spiritofgivingvote to cast your votes for your favorite equipment.